Good morning and welcome to Southern Maine Healthcare's Medically Speaking. I'm your host, Robert Erickson, and for the next 30 minutes, you'll hear about medical issues and topics of the day directly from leading medical professionals at Southern Maine Healthcare. My guest today is Chelsea Firk, a registered and licensed dietitian at SMHC. Chelsea is here to share some tips on nutrition during cancer treatments. Welcome, Chelsea.
Thank you.
Chelsea, maybe we could begin by having you tell our audience what a registered dietitian is. Maybe they don't realize that medical facilities have registered dietitians.
Registered dietitians are food and nutrition experts. What we primarily do is translate all of the scientific research that's done about food, how our body uses the food that we eat, into real life and practical solutions for people to live healthy lifestyles.
Is there a difference between a dietitian and a nutritionist?
Yes, a registered dietitian is someone who has earned at least a bachelor's degree from an accredited college or university, and after earning that degree completes a additional accredited internship program. And the internship program can take place in a variety of settings, whether it's in healthcare, in a food service environment, or also in community settings. Once that's completed, there is a exam. It's a national registration exam, and even once you've passed the exam, there's continuing education requirements that are required. You have to meet them every 5 years. So there's quite a bit of structure to the program to earning the RD credential.
So how did you personally end up in this profession? What was your personal journey that led you here?
It was really my childhood. My dad is a dairy farmer and my mom works in food manufacturing. So I really got to see both sides of how we grow our food and then what food products are manufactured for people to eat. And I did spend a lot of time working in high school, working at the food manufacturing company that my mom works at. And it was very interesting to see that side, having grown up, seeing the farming side. So I wanted to do something that combined both of them together, and teaching people how to eat healthy definitely allows me to do that.
I'm sure you had many opportunities to work at other organizations. How did you end up working for a healthcare organization?
Yes, dietitians are employed many places in our society. There's dietitians that work in healthcare, long-term care facilities, the outpatient setting. There's dietitians that work in schools, both colleges, universities, school nutrition programs. There's dietitians that might work at sports facilities. It could be sports performance or just at your local gym. Again, keep in mind the RD credential we talked about earlier. There are also nutritionists, and nutritionists are different than dietitians in some cases. Every registered dietitian is a nutritionist. Not every nutritionist is a registered dietitian.
Now, the knowledge about diet is much greater than it used to be. Thinking back to the old days, the 50s and 60s, it seems like people didn't have the knowledge about diet that they do now. What do you attribute that to?
I think our food system has changed a lot. If we think to what the food system was in 1950 to what it is now, we certainly have a lot of different options to us. Just the number of restaurants, the number of fast food restaurants, the number of choices that we have at the grocery store. We also have several different grocery stores. There's a difference between how every grocery store markets and chooses the products that they provide to consumers. And I think it's the increase in the amount of choices that we have to make about food each day that really makes people more aware of it and also more interested in making the right choice.
Now, how does the average person keep up with all of the changes in the food world? We just learned recently that eggs and bacon are okay, that the cholesterol is not necessarily that big of a problem. How do you as a professional keep up with it, and how can the average person keep up with the changes in the food system?
As part of being a registered dietitian, we do have to meet continuing education requirements each year for the state and then every 5 years for our national certification, and that helps. There's a lot of different conferences, webinars, and things that we will attend so that we're able to stay on top of all the new recommendations. Not only is our food system changing, the way that animals are raised, the way that they're fed, all of those things do affect the outcome of the food that they provide us with, whether it be their eggs, their meat, anything like that. So the research that's done evaluating the end nutrition content of those foods we eat is also always changing.
Now, we're here to talk about how the challenges of people who are battling cancer have in their choices of food and nutrition. How big of a challenge is it for somebody who has cancer to maintain a healthy diet?
When undergoing cancer treatment, there's a lot of extra stress on the body from either the chemotherapy or radiation treatment or a combination of both of those. And one thing that becomes very important is making sure that you're consuming enough energy. And that's energy both as calories and also as protein. Someone who has cancer and is undergoing treatment can burn up to 1.5 to 2 times as many calories as when they were healthy. A lot of people with cancer have at some point likely experienced some unplanned or unintentional weight loss. And as they go through treatment, we try to prevent any additional weight loss, help to maintain their weight, and try to make their body as healthy as possible. Another thing that goes along with cancer treatment is the different side effects from the medication or the radiation that someone might be receiving. Those side effects can be things like loss of appetite, early satiety, nausea, vomiting, constipation, diarrhea. Taste changes are also very common, and you can imagine having any of those side effects would make it even more difficult to eat. So now you're in a situation where your body's using more energy and you don't want to eat as much. So nutrition becomes very important to maintain energy level, which makes the outcome of your treatment much more positive.
Is there one really important thing that cancer patients need to do? Is it increase caloric intake, protein? What is it that cancer patients need the most?
Most people need to definitely increase their protein intake just because of your body dealing with that extra stress of the treatment and also the illness.
So what would be the most common question if you were counseling a cancer patient that you might get about nutrition?
Most people who are in treatment, it's really managing side effects. So there's usually somebody doesn't have every single one of the side effects, but there's one that really prevents them from being able to eat either the way that they used to or just take in enough energy. So really that's my focus when I'm sitting down with somebody who's active in treatment is how can we get you enough energy to make it through these treatments and keep your weight where it is.
So if someone's feeling ill with nausea or other side effects, what can you do for someone like that?
There are some foods that people find help to settle the nausea. Ginger tea is a common one, peppermint tea. Avoiding foods that have strong odors. A lot of times, especially cooked meats, will tend to have a very strong odor when you sit down to eat them. And if you could imagine you're already feeling nauseous, if you sit down to this meal that has a lot of smell to it, that doesn't really help. So we might use cold foods. We might look for some alternative sources of protein like dairy or beans, things that don't have as much of an odor to them. And certainly making sure that they're staying hydrated helps sometimes to manage the nausea as well, and taking your medications as scheduled. It's likely that the oncologist has prescribed an antiemetic medication or anti-nausea medication, and making sure that you're taking that ahead of the nausea.
So when you're counseling a cancer patient and you sit down with them, what can you tell them as a nutritionist that will make them feel better?
I can tell them that I understand the side effects that they're feeling can absolutely decrease their appetite. And it's hard to eat without an appetite. It really is. Food is more than just fuel for most of us. A lot of us have our favorite foods, and not only do they fuel our body, but they make us feel good. They provide us with satisfaction that is sometimes greater than just the sense of being full. And if you can imagine being sick and undergoing this harsh treatment and then not even being able to taste your favorite foods, it's very hard to continue to eat them. So food is fuel for your body, and you need it to make it through this, and you need to almost think of food as another medicine as you're going through treatment, because without the food, your body might not work as well, and you might have other complications if you continue to lose weight or continue to not get enough nutrition.
Let's talk a little bit about other side effects for cancer patients. Obviously, we've talked about nausea, and that's an obvious one. Are there other things that cancer patients run up against? A metallic taste in the mouth, for instance, something like that makes it difficult for them to eat?
Yeah, the taste changes can be very significant. You might find that food just doesn't taste like anything. Some taste might become more pronounced. So you might find that piece of chicken that has different herbs and spices on it is way spicier than you ever noticed it to be before. A lot of the animal proteins might even taste more metallic than just the metallic taste you already have. So again, looking for those alternative sources of protein. Something else with the metallic taste, using plastic silverware can be helpful, because then at least you're not putting that metal spoon into your mouth. Using ceramic or glass for cooking instead of the typical metal pans that we have can be helpful. There are different mouth rinses. We have a really nice handout I give to patients about different mouth rinses that they can rinse out their mouth with before they would eat to help remove some of those tastes.
Now, you also hear about cancer patients going on different diets, for instance, a macrobiotic diet. What are your thoughts on something like that? There must be a lot of those kinds of things out there.
I think that you definitely go to extremes when dealing with an illness like cancer at times. And the macrobiotic diet is not something that I'm super familiar with, and it's not necessarily something that I recommend. Again, I'm working with people on we need to get enough calories into you, enough protein into you to stop the weight loss. And I think that specifying it down to that level for some people, if it's a struggle to just get enough calories and enough protein, to add on a whole other laundry list of recommendations might not be easy. It might be more stressful. So I don't want to add any extra stress to that. I think that making changes to the way you eat, if you're trying to live a healthier lifestyle, would be something to work on once you've finished your treatment. And we can, of course, work on incorporating healthy foods if your appetite's great and you're able to eat them while you're going through treatment as well. But it really depends on where a person's at.
Are there any new foods that have come out onto the marketplace that are specifically for this type of person?
There's a lot of the commercially prepared like oral nutrition supplements that provide a concentrated source of calories and protein. They're usually in a liquid form, which makes them easier to drink. If we think about having a day where we have a poor appetite, it's usually easier to drink something than it is to eat something. If we're feeling weak or feeling tired, the same thing. It's easier to drink something than it is to eat something. So those are always an option. There are a lot of cookbooks out there for foods that can help with some of the taste changes, help with any chewing or swallowing difficulties that might have come about. And so they're soft, easy to chew, easy to eat things.
Now, in addition to the foods for the cancer patients themselves, there are people who are not sick are interested in preventing cancer. What are your thoughts on something like that?
There's been a lot of research recently on the benefits of phytochemicals. Antioxidants are a type of phytochemical that tend to get a lot of popularity or press, so that might be a more familiar term for a lot of people. But what these phytochemicals do, or what they're finding in the research, is that they help to pick up any extra free radicals that are floating around our body. And this helps to prevent cancer, is the thought process around that. So where do we find phytochemicals? Phytochemicals are in all of our fruits, vegetables, and whole grains. They're chemicals that are part of the plant, and they can, again, be found in any fruits, vegetables, whole grains. The fruits and vegetables that tend to be brightly colored usually have more of the phytochemicals in them. So adding as much color to your plate is always a great rule to follow. We can think of something as simple as our lunch, which might be a turkey sandwich with some chips or pretzels on the side. If we think about ways we could add color to that and make that a healthier lunch, we could use avocado instead of mayonnaise on it. So now we've added some green. We could put some tomato and red onion. So now we have red, we have purple on our sandwich with the green avocado. We could swap out the chips or pretzels for some grapes and some carrot sticks. So we have a little bit more purple and red, and we've also brought something orange. So if we were to put those two plates side by side, we would see very different things, and the plate with more color is likely more nourishing, more satisfying.
Now, you just mentioned the term free radicals. Why don't you tell our audience what that is?
Free radicals are substances that are produced by any natural processes in our body. They can also be introduced by outside sources. So whether that be something like tobacco smoke or other pollutants in the air that we might breathe in. The free radicals are thought to cause damage to our cells, to the proteins in the cells, and also our DNA because they change the chemical structure of the cells that are in our body.
You're listening to Southern Maine Healthcare's Medically Speaking with Robert Erickson. My guest today is Chelsea Firk, a registered and licensed dietitian at SMHC, and we'll be right back with Chelsea after this brief message from SMHC Walk-In Care.
Not every boo-boo is an emergency, but it still feels like one. That's why Southern Maine Healthcare offers walk-in care. You'll find compassionate care at wonderfully convenient locations. Open 7 days a week, no appointment necessary. For those times when the unexpected happens, or you're just not feeling great, look for the orange ball as your sign of the best walk-in care. In Kennebunk, Saco, Waterboro, and Sanford, Southern Maine Healthcare, a member of Maine Health.
And we're back talking with Chelsea Firk from SMHC. Now, there's so much to know about food. How can the average person get a handle on what's best for them? Shopping in the grocery store, for instance, are there guidelines where you can tell somebody the healthiest way to shop in a grocery store?
The perimeter of the store is definitely the best place to shop. So usually when we walk into the supermarket, the first section we walk to is the fruits and vegetables. So we talked about fruits and vegetables, they're phytochemicals. Fruits and vegetables also have a lot of other vitamins, minerals. They have a high water content. They have this great thing called dietary fiber in them. That is one thing that helps us to really stay feeling full and feeling satisfied. So any of those fruits and vegetables, definitely great choices. When you move to the next section of the store, which might be usually the meat, looking for meats that are low in fat or lean proteins as we call them. So this could be skinless poultry, it could be fish. There's many different types of fish, seafood available. It could be lean beef, lean pork. The loin or round cuts tend to be the most lean or lowest in fat. When you get to the dairy aisle, again, low fat or fat-free dairy, 1% milk is completely fine. It's a low-fat dairy choice. There's also a lot of milk alternatives out there, whether you use milk alternatives just because you don't like the taste of milk or because you're lactose intolerant or have a dairy allergy. Look for the milk alternatives that are unsweetened. A lot of times the sweetened ones, the chocolate or vanilla flavored, tend to have a lot of added sugars to them. So it's best if you can enjoy the unsweetened versions of those. With yogurt's another dairy food. It's a great source of protein, calcium, vitamin D, and there's lots of variety with yogurt. Again, watch the added sugars in some of them.
Now, we're often told about the middle of the grocery store is where the processed foods are, and we hear a lot about hidden sugars in different foods. Why don't you talk a little bit about that subject?
In the middle of the store, you're right. We have a lot of processed foods, a lot of foods that are packaged, and they can stay on the shelf for quite a long time. There's certainly healthy choices that we can make within the middle of the store. Usually in our food system, we have basically 3 trouble nutrients. We have sodium, we have fat, and we have sugar. If you were to ask 10 people, what are you trying to reduce or eliminate from your diet? It's likely that 9 of them would say one of those 3 things, or maybe even a combination of 2 of them. So what we tend to find in the middle of the store is we might have 3 different kinds of crackers. One cracker is a low-fat cracker, one is a low-sodium cracker, and maybe one is the regular cracker. In the low-sodium cracker, it's likely that there will be more sugar and more fat in that cracker to make up for the lost sodium from the recipe. So it's really important to know what your nutrition goals are. So if you've been told by your doctor or your physician that it's best for you to watch your sodium or watch your sugars, know what your goals are, know how much you're looking for a day, learn how to read nutrition facts labels, which nutrition facts labels have a lot of information on them, and it does take time to learn how to use them. Registered dietitians are a great resource for helping you to navigate both food choices, the grocery store. Most grocery stores have dietitians available to help you with that as well.
Now, we often hear about sugars in fruit, sucrose. Are there differences between fresh fruit and dried fruit?
Dried fruits do tend to have added sugar to them. They, especially something like cranberries comes to mind right away. A cranberry is very tart, and when they dry it, it becomes even more tart because we've lost the water. And so they do usually add a lot of sugar to something like that. And there's even some other fruits, if you've seen any other dried fruits, you can almost see the sugar on the outside of them. So in that case, yes, having the fruit in its fresh form would be a better choice. Fruits in their fresh form, the serving size that's recommended is larger because there's more water content. So we get to have a bigger portion size of them. And the fiber tends to be a little bit higher. And there's, again, the vitamins, minerals. Some of those might be lost in the drying process. And it's likely to leave you feeling more full and more satisfied if you have, say, a fresh apple versus apple chips.
Now, what about people who are lactose intolerant? In terms of dairy products, what are the options for someone like that?
There's a lot of different milk alternatives out there. They have milk that's made from rice, almonds. I even saw cashew milk recently. And soy milk has been popular for a while. There's a lot of different dairy alternatives out there. Most people with a lactose intolerance can tolerate small amounts of harder aged cheeses, yogurts, because in the process of making those foods, a lot of the lactose has been removed. So those are options as well. And they even have cheese and yogurt that's made with soy or other milk alternatives. So there's definitely tons of options now, even for people with food allergies.
Now, when you're counseling a cancer patient and they're really having trouble just eating food and gaining weight, what are the things that you talk to them about to help them focus and know what to do?
I usually put the focus on protein. Protein helps to maintain your body's lean muscle mass, and especially going through cancer treatment where your protein needs are much higher than they are before you have cancer or before you start cancer treatment. Your body just needs that extra protein. It's very important to helping maintain your lean muscle mass. If you start to lose your lean muscle mass, you might experience rapid weight loss. You'll become very fatigued, very tired, and it's really important that we maintain that. So I always focus on protein first.
Can you give us some examples of foods that are high in protein?
Any meat or animal products, so whether it be fish, chicken, beef, pork, tuna, dairy products, again, are a good source of protein. Cheese is a great protein. That is one of those foods that's cold, and it doesn't usually have some cheeses have odor, but not all of them. Beans, nuts, like peanut butter, can be a good source of protein. And then there's also the nutrition supplements that are available as well.
Now, if someone's been a vegetarian their whole life and they're a cancer patient, is that a particular challenge? What do you tell someone like that?
There's plenty of non-animal sources of protein. We have beans, we have seeds, we have nuts, we have legumes. There's lots of different options there. Certainly, it's important with a vegetarian diet that you get many different sources of plant protein so that your body can make complete proteins. And again, that's another area that working with a registered dietitian can provide you with a lot of benefit to make sure that you are completing all those proteins.
Now, for everyone in general, and I suppose especially cancer patients, people who are ill, is it important to be focused on food safety issues?
Yes, it is. Foodborne illness is 100% preventable if we take care of the way that we prepare, store our food. And this includes both foods that we bring into our home, or it could be leftovers, anything like that. And I usually talk with patients about making sure that they are cooking their foods, all foods to appropriate temperatures, making sure that they store everything safely, getting rid of things when it's time to get rid of them. There's lots of information out there about cooking temperatures, reheating leftovers.
Now, we've talked a lot about how you counsel patients in the hospital. Can anybody just call a registered dietitian to get some advice on what to do?
Yes, anybody could see a dietitian. Certainly anybody that's interested should definitely reach out to a registered dietitian if they have questions about food, nutrition, or making a healthy lifestyle. People that have any chronic diseases, diabetes, hypertension, it can be helpful as part of their care treatment plan to meet with a registered dietitian and develop a specialized meal plan to help manage those conditions. Anybody who's considering weight loss surgery or has maybe had weight loss surgery in the past, nutrition is a very important part of that process. Anybody with digestive issues, whether it be another type of chronic disease, multiple food allergies, anything like that, dietitians can be very helpful in navigating those complicated situations. Pregnant women that are trying to get pregnant, and children, especially as they are learning to increase or add foods to their diet as they age. Anyone who desires a change in their weight, whether it be a weight loss, a weight gain, registered dietitians can definitely help, again, put together specialized meal plans to accomplish those goals. Anybody who's maybe caring for an aging parent or family member, a lot of times there's multiple food recommendations or nutrition recommendations that might be because of certain medications, because of, again, chronic diseases or conditions, and taste changes as people age. So it's important to make sure that you're maintaining your nutritional status as you age as well. And of course, anybody who wants to eat healthier. Sports performance can be another thing that registered dietitians can work with people on. So there's endless reasons of why somebody might want to see a registered dietitian, and we're here.
So how can someone access a registered dietitian?
Certainly, we have registered dietitians at Southern Maine Healthcare. We have them at both locations, and we're present throughout the community as well. There's eatright.org, which is the website that's maintained by the Academy of Nutrition and Dietetics, and there is a search for a dietitian in your area spot on that website. Reaching out to your local hospital, if SMHC is not your local hospital, they can definitely get you in touch with their dietitians. Asking your primary care doctor, physician, if they have dietitians that they work closely with.
We've talked about a lot of different things. What if someone wants to get information, specifically cancer patients who need nutrition information? What's the best thing for them to do?
Again, eatright.org has a lot of information for both health professionals as well as the general public on nutrition. They do have some articles specific to nutrition during cancer treatment on there. And cancer.org, which is the American Cancer Society's website, they have tons of great articles on nutrition for both during treatment, after treatment. They have an article on there about phytochemicals. So there's tons of information on that website as well.
So I'm sure you're making customized plans for lots of different people. What's involved in making a customized plan for someone's nutrition needs?
I think that when people anticipate making lifestyle changes, they are maybe worried or concerned that there's going to be drastic changes, that they might have to cut out an entire food group, or they'll never be able to eat things that they once loved. And a great thing about working with a registered dietitian is that we really take into consideration your entire lifestyle. So we talk about things like, what is your food budget? What does your day look like? How much time do you have for food preparation? What cooking skills do you already have? What cooking skills are you willing to learn? And then we talk, of course, about what foods would be the best and within your food preferences. And by doing that, we're able to come up with a customized plan that will not only help you to meet your health goals, maybe your weight loss goals, weight gain goals, whatever they might be, choosing foods that you love, choosing foods that you're familiar with, that you yourself can go home and prepare and purchase within your budget and within the time that you have available. So we make real life solutions for people.
Well, we've run out of time for this week. My guest today has been Chelsea Firk, a registered and licensed dietitian at SMHC. Chelsea, thank you for sharing some time with us.
Thanks for having me.
Join me next week at this time for a new guest and an enlightening discussion about healthcare in our communities, brought to you exclusively by Southern Maine Healthcare, your trusted resource for healthcare in Southern Maine.